Well, welcome everyone to the first Wednesday webinar in our Spring 2020 CHAMPS Wednesday webinar series. Thank you all for joining. Today's webinar is called Crossing the T and Dotting the I's in Designation, Organization, and the Final Push. My name is Maytal Hoss-Kogan, and I'm a part of the CHAMPS team. And I'll be starting off the presentation, and then we're so excited to be able to start off the series hearing from some hospital representatives, Nicole Jeans and Jennifer Caldwell. And they'll be telling us about their and their team's experiences getting ready and organized for their baby-friendly on-site assessments. So before we get started, I just want to make a couple quick notes. The first is if you could please mute your line while on the call. You can do that by pressing *6. You can press #6 to unmute. And you can use the chat box should be on the right side of your call if you have any questions at all during the time. And second is that the slides and recording of the webinar will be up on our website and YouTube channel after. So if you miss anything, don't worry. You can always go back and listen again. So just some logistics and updates from CHAMPS before we get started. First is our upcoming training. So we have an upcoming 4-hour training on March 12th at Wayne General Hospital, and registration is now open for that one. And then we have another 4-hour at Northwest on April 29th, and the safety training at Southwest on April 2nd. Here's just a list of the rest of the Wednesday webinars. If you want to write them down, put them on your calendar so you're sure you don't miss out on any of the other wonderful webinars we have coming up. Some CHAMPS updates. So Mississippi now has 18 baby-friendly hospitals, which means that over 50% of births in Mississippi are happening in baby-friendly hospitals, which is an amazing accomplishment thanks to you all. And a big congrats to the 3 most recently designated hospitals, which are Southwest, Mississippi Regional Medical Center, Methodist, Le Bonheur Healthcare Olive Branch, and Mississippi Baptist Medical Center. So the CHAMPS team is so proud of all the hard work you all did, and we hope that you're still beaming from this accomplishment. All right, so let's dive into the meat of the webinar here. So I'm going to just begin by presenting an overview of what Baby Friendly will expect for you to have organized and ready on your on-site assessment dates, and then we'll have our hospital representatives take over and discuss how they prepared in particular. And again, the slides and recording will be on our website after in case you want to go back or listen again. And again, you can chat in any questions you may have, and we'll answer them at the end of the webinar. So I'm going to begin by outlining 6 categories of materials you need to gather, and I'm going to use this nifty little acronym here, PREPT, which stands for Policies, Rosters, Education, Purchasing, Posters, and Trainings. So first are your policies. So you'll want to have your most up-to-date version of your infant feeding policy with any changes highlighted that you made since Baby Friendly USA's last review, and also any related policies. Next are your rosters. So for nursing staff, you'll want to have a roster of all your nursing staff scheduled to work all shifts during the 2-day visit. For MDs and APNs, you'll want to have a roster of all staff with privileges for the maternity unit. And if you're scheduling interviews, you'll want to include that schedule as well. For patients, you'll need a roster of your prenatal patients if you have an affiliated clinic, postpartum patients, and NICU patients. And I want to note here that the patient numbers on this slide are Baby Friendly's minimums for your rosters, and CHAMPS strongly, strongly recommends having more patients to ensure that your assessors are able to conduct all the interviews they need to and able to conduct them easily. And if you will not have this many patients on the floor or in your prenatal clinic on the days of the on-site assessment, you'll need to prepare patient call lists. And lastly, you'll need to obtain permission to interview the patients in advance, either in person or on the phone. So next, the E. So for prenatal education, this will depend on if your hospital has an affiliated prenatal clinic, but you'll need your affiliated prenatal clinic curriculum if that applies to you. You'll also need descriptions of all your in-hospital prenatal curriculums, and explanations of how the education is communicated. For example, for tours, you'll want descriptions of what is discussed and where you take them. You'll also want copies of your prenatal patient education materials. And I really don't think I can stress this enough. You want to review your materials with a very fine-tooth comb to make sure that it is all compliant with Baby Friendly USA guidelines. A couple common things that get overlooked is that you'll want to make sure there are no handouts that mention formula or bottle feeding or even have images of bottles or pacifiers. You'll also want to make sure that only cue-based feeding is taught. So there should not be any messages like feed every 2 to 3 hours or feed 10 minutes per side. You'll also want to have descriptions of community collaborations with programs like WIC, Baby Cafe, or La Leche League. Moving on to postpartum education. So same as for prenatal, you want all your teaching curriculums, and you'll also want your checklist related to the Baby Friendly Hospital Initiative. You'll want copies of any education you give to moms in postpartum preparing for discharge. And again, like with prenatal, you want to make sure everything is compliant. So only mothers going home formula feeding should receive handouts on safe formula preparation, and all mothers should be told to feed on cue. Often we see that formula feeding moms are sometimes still being told to feed every 2 to 3 hours. You also want a description of your postpartum referral system, including coordination efforts with community partners. For purchasing, you'll want your fair market price onset assessment preparation grid, as well as your fair market price code compliance verification form and a description of how fair market price was set. And for these invoices and proof of purchases, you'll want to include a canceled check, bank statements, or ACH receipt. For the 10 Steps posters, so you'll want copies of the posters and a list of where you hung them. You want to make sure that your posters have the exact same language as the example Baby Friendly provides. You can't remove or add language to your posters, and we've had several hospitals have to correct this after they're on-site before they could be designated. So just keep that in mind. All right, and the last part of our acronym here, training. So you'll want to have copies of the staff training curriculums for any trainings that your nursing staff and physicians completed. You want to include this DEV-8D document. And if you use LER, this checklist has already been filled out, and you can reach out to them or CHAMPS team for a copy, excuse me. For rosters, you'll need staff rosters that note the date the trainings were completed and when orientation to the infant feeding policy was completed. And Baby Friendly also has a document, the staff training documentation, DV8A, that you can use for this purpose. One thing to keep in mind that's sometimes overlooked is that not only nurses but also physicians have been oriented to the infant feeding policy. So regarding certificates of completion, assessors will usually review certificates of staff they interview. So you don't necessarily need to keep every staff member's certificate in the binder, but they should be available to Baby Friendly if they ask for them. You'll also want to include curriculum and documentation of any basic training for any other categories of employees. So 3 key tips to keep in mind. The first is just to use the Baby Friendly USA on-site checklist. And you'll want to remove any unnecessary documents that you might have gathered over the years that might confuse assessors. Different assessors will want to see various aspects of all the different documentation you have. So maybe some will look at purchasing receipts more, some may focus more on staff training. So it's just important that you have all the documents ready so that there are no moments of stress or more moments of stress than need be on your assessment days. The second tip is just to assign people ownership over various pieces so it's really clear who is responsible for each part of the checklist. And the third is just to know your own strategy so you don't lose track of where things are in your paperwork and you don't let all of your hard work that you've done preparing go to waste. So I am now going to pass it off to Nicole Jeans. She'll start us off. And she'll talk about her and her team's experience at Methodist Olive Branch, and then we'll hear from Jennifer Caldwell from NNMC Women's Hospital. And both of these women were true rock stars on the organization, among many other fronts, and we're so excited to get to learn from them today. So I'm going to pass off the All right, Nicole, you should be good to go.
I am. Hello, everybody. My name is Nicole Jeans, and I'm going to move this up. Went backwards. And I'm going to go over how we prepared. So as we all know, Champs and Baby Friendly, they help to provide us with all of the information that we need. And so I just wanted to kind of go over how we took that information, organized it, as Natal said, own that strategy, know it, and go forward from there. So here we go. I'm so sorry. So again, I said my name is Nicole Jeans. I am a lactation consultant and labor and delivery nurse for Methodist Olive Branch Hospital. We are just a few miles away from Memphis, southeast of Memphis. We're considered a suburb, actually. And we are a relatively young hospital. We will celebrate 6 years of service this year.
I'll talk to you later.
Okay. Sorry. Our inaugural year, we delivered 315 infants, and last year, as you can see, we doubled that, more than doubled that, with 711 babies. We have 6 LDRP units, 6 postpartum rooms, a triage and antepartum room. We are not a very large facility, but we are striving with this culture change, and we are very proud of the things that we've achieved in this short amount of time. And we are the first of 3 delivering hospitals in the Methodist Le Bonheur system celebrate baby-friendly designation. Okay, so as I was looking through articles on organization, I came across one simple sentence that wrapped it up pretty perfectly, and it is that organization is a prerequisite for success. So if you can focus on taking all of this wonderful information and organizing it well, you will be able to relax, and yes, it is possible to relax on the days of your on-site assessment. It helps incredibly so to be organized. It is a vital component of the journey. It allows your task force members to spend less time searching for information or correcting mistakes during your on-site assessment, and having everything in order, as I said, will encourage a quick and stress-free visit from Baby Friendly. So, getting started, I know that most of you have probably already done this, but having a little bit of administrative background, I really took the organization of this process to black and white, to paper, and having a checkoff list for me was very, very helpful. I started with the dashboard from the Baby Friendly portal. I built, I literally went through every link, through every step, and started taking notes to see what we had completed, what was completed, and then crossed off everything that we gotten done, making notes going forward from there. So once you've gone through the dashboard and you have a good idea of what needs to be done, you can also use the on-site assessment checklist to make an outline. It is number 12 under the dashboard. You'll find the link there for your on-site assessment checklist. This document will keep all of your information organized in one place. It will also begin to assist you with the creation of your binder, and so we all know that the binder can be a headache, and so it's very important that we keep everything organized with notes so that you have everything you need. You don't want to be searching for those things during your on-site assessment. So I'm going to click forward and show you kind of what our checklist came together and began to look like. And it was literally just copying and pasting everything originally into a Word document and then modifying it frequently throughout the process. So as you can see here, I prepared the outline. I used different colored fonts, different color, notes to update. If it was something that was time sensitive, it was in red. If there were links or if there were other forms or pieces of paperwork, I had it highlighted a different color. As we moved through the preparation, I added notes from our mock visit, from the RAI, through the monthly chance calls, and I was frequently going onto social media, looking through the support groups online and taking notes from that as well. So all of this eventually came down to the binder itself. Using just a standard Avery tab system and the recommendations for the sections by Champs and Baby Friendly, we began to piece everything together. Each section, we were recommended to create a header page. I'll show you that in the next few slides. It explained all the contents. It made everything very easy to find for the assessors and for us as well, so that we didn't sweat whenever we were asked for a particular document. Okay, so this is an example of how the header pages looked, and this was in the front of every section of our binder. We would give a brief description, then the contents in the order. We kept everything in order as you would with a table of contents in a book. If, you know, one form was on page 1 or first, you would expect for it to be there so that when the assessor asks for it, you know exactly where to go. Let's see. Now, at the bottom, this is something that I wanted to add. This is at the bottom of every header page that we had. As we know, even when it comes time for the on-site assessment, that does not necessarily mean that everything is going to be completely done. We are always a work in motion. We are always continuing to strive to improve and change and be flexible as we move forward with our baby-friendly journey. And so there we had a little section at the bottom that said plans for improvement. So if there was ever anything that we were continually working on, or if we had some shortcomings, be it for the policies or our community outreach or anything, we wanted to make sure that Baby Friendly knew the things that we were working on, but maybe that we hadn't completed or you know, finalized by the time that they came. So, and it also gives you a little bit of space for them to see that you acknowledge that it is a work in process, and it will continue to be a work in process as you continue beyond designation. So, okay, so staff training. I know Maytal mentioned the certificates. For us, even though we are relatively small, the staff training certificates turned out to be a pretty significant portion of the binder. And in wanting to maintain organization of the paperwork, the binder became very thick and overwhelming, and I did not want to hand that off to our assessors. So I did see in one of the online Facebook posts that someone had chosen to use a box, a file box, to remove the bulkiest pieces of the binder. And for us, that idea was a godsend, and I'll show you in the next slide how that became so helpful. Okay, so as you can see here, this is our staff paperwork. So if we had certificates for policy review from the physicians and the staff, we had the 4-hour completion, we had skills fair completion certificates. If there was a piece of education that was required or training that was required, we had a piece of paper signed by the associate to show that yes, indeed, this was the date, and the assessors could go to it to get proof, and it was very easy to find. So, okay, just like with the binder, I did create a table of contents for the file box, and so if the assessors opened up the file box, they would know exactly what was in there. So you can see here we started out with the policy, then we went to skills validation, then completion certificates. I wanted to make absolutely sure that we were able to locate things quickly and that we had everything within a finger's reach for the assessors.
We don't have that.
All right, so I also made sure, and this is really important, when you to put all of your staff completion percentages together. If the staff names go in a certain order, say maybe it's alphabetical, or it's from hire date or date completion, I would put all of your paperwork in the exact same order that it is listed on the spreadsheet that you're using to show your completions. This also helps you locate all of the information very quickly. And for us, whenever the assessors came, they had very specific employees that they wanted us to pull this information on. So it was very, very easy for us to locate every piece of paper where they had signed that they completed certain pieces of required education. Okay, so the assessor binder. We had the main binder, and then as a recommendation, I believe from CHAMPS, we had assessor binders as well. You know that each assessor will want a copy of, say, the fair market value grid and some of the other information like the agenda, maybe the staff rosters, general information for your hospital. I wanted to make sure that each of the assessors had this information at their fingertips. And as a courtesy, we also included information on local restaurants, places to purchase different, you know, like if they needed small items from a store that's local, we wanted to make sure that they knew where it was because we know that they are far from home, and this was a courtesy for them. Okay, so once your paperwork and everything is in order, make sure all of your humans are well organized as well. We did take some time, the task force and I took some time to try to make the preparation fun. We laminated quiz sheets and quiz cards and left them at the nursing station so that with any downtime, even though that is few and far in between, but when we had moments of quiet, we would quiz one another. We also had badge buddies so that people could often look down at their badges and review the information that they needed to keep at the forefront should they be asked these questions on the day of the assessment. We also had toilet time flyers, which the staff got tickled over. So if they had a moment to actually take a bathroom break, they could read even more about what to expect on the day of our assessment. And so being familiar with your agenda is very, very, very important. Just before the visit and on the morning of your visit, make sure that you discuss the agenda with all of the staff members, including those that are coming in for the roundtable meeting, like your C-suite associates. Be very clear, and as Maytal said earlier, assign roles to your task force members. Make sure that they know what they're doing. If you have to kind of walk through a mock visit, then that might even be a great idea, just so that everyone knows exactly what to expect. Okay. Now that you have everything neatly organized, you can hopefully relax a little bit on the day of the assessment. The phone calls during the monthly conference calls with CHAMPS, they were very, very important. I absolutely loved listening to other hospitals recall what happened, what to expect. I took notes, what worked well, what didn't work well, what they wished that they had done. We wanted to make sure that there were really no surprises. We wanted to plan ahead, but also keep in mind that you have to maintain a certain level of flexibility because there will be surprises. You might have an associate call in sick that you expected to be there, or maybe a physician gets tied up with a delivery when you expected them to be present for an interview. You have to be flexible and know that things could change, and that should set the tone for a cool and relaxed 2 days, hopefully. Be organized in both time and materials, and try to plan ahead, as I said. Remember that Baby Friendly really wants us to be successful. Approach the visit with the excitement of gaining that designation versus anxiety about not being able to cross through that finish line. In short, keep these things in mind. As I said, keep your information easily accessible. Have everyone you need available for the visit, like your administration people, purchasing, physicians. Make sure you keep in contact with them in the days leading up to the visit. Make sure that they have it on their calendar. Make sure your task force members have very clearly defined roles, as I mentioned, and again, be flexible because things may change. So where do we go from here? As we said, we are designated now. We are so motivated and will continue to build on our culture change. We love getting new information, all of the updates to the guidelines. We are flowing and flexing as these changes come down the line. We are so incredibly proud to be a baby-friendly hospital, and we will absolutely stay committed to the path that we paved along the journey. And I look forward to seeing more and more Mississippi hospitals and nationwide more hospitals move into this celebration of being designated. So we all wish you the best of luck with your on-site assessment, and if anyone has any questions, I would absolutely love to help you out. So that's it for me. It looks like I wrapped up a little bit early.
Thank you so much. So now I'm going to pass it off to Jennifer. And again, if you do have any questions at any point, we'll take questions verbally at the end, or if it comes up and you want to chat it into that box on WebEx, we will also go through those.
Okay. So Jennifer Caldwell from North Mississippi Medical Center in Tupelo. We're at the Women's Hospital. We're a freestanding facility in Tupelo. And I'm a labor and delivery nurse by trade. May tell my slides are not advancing. Oh. Okay, here we go.
Great.
I'm a labor and delivery nurse. I've been at Women's Hospital since 2001 and was labor and delivery nurse at the bedside for several years, and then was clinical educator for several years, and then a nurse practitioner in our outpatient and a part of testing unit. Moved into the role of director of nursing. Like I said, Women's Hospital, we're a part of the North Mississippi Medical Center, which is located in Tupelo. The medical center is a 640-bed referral center, but Women's Hospital is a freestanding facility. Our building was built in 1986, and we moved over a couple of blocks from the main campus. Here at the Women's Hospital, we have a labor and delivery unit that has an 8-bed triage department and a 15-labor-bed labor and delivery unit. We have 36 mother-baby couplet rooms, and then we have a level 3 NICU with 34 NICU beds. In our facility, we also offer OBGYN surgical services. We have 2 C-section suites, 2 robotic suites, so a total of 6 surgical suites in our facility. We do about 2,200 deliveries annually. We have 9 private OBs that deliver, and we do have an OB hospitalist group that manages our triage and OB emergency department, and they also deliver a few babies for us as well. We have 1 maternal-fetal medicine specialist here in Tupelo, but unlike some of the other facilities, we do not have any affiliate prenatal care services. All of our prenatal care providers are private. We have about 190 RN staff between labor delivery, mother-baby, NICU, and then with our resource pool. And I think that was one of our challenges, is just, trying to get organized, and how do you stay on top of 190 people when you have people that are coming in, new hires, and then people transferring out of the system. That was a big challenge for us when you have so many people. And then also educating them and making sure the message, any changes in the education gets transferred to all of those. It's kind of hard to put your hands on 190 people and make sure everybody gets the same message. So that was one of our challenges throughout our journey. We also have 3 lactation consultants on staff here. One of those is primarily dedicated to our NICU. So we began our baby-friendly journey back in October of 2015, and then quickly transitioned to the second phase in April of 2016. And then we moved to the third phase in June of 2018. And then we had a leadership change, and that's when I transitioned to the role of Director of Nursing and then became the leader of the Baby-Friendly Task Force. It took me a minute, probably more like several months, to get acclimated to the role and then learn more about the Baby-Friendly initiative and learn it from not just a bedside staff member, but more from a leadership role. And so we moved to the final days of D4 in May of 2019, and then we had our on-site assessment January 8th and 9th, and we're still, I can't say patiently waiting, we're anxiously waiting to hear our results, and hopefully that is designation. So just to, a spin-off of the previous slide, I said we started the baby-friendly journey in 2015, but honestly, this was a vision of our lactation consultants and the previous director. And so they began efforts to become baby-friendly back in 2010. And so even though we were only on the baby-friendly timeline for about 5 years, it's really been a 10-year project in the works. So I have to give kudos to those before me. I have to say, without a doubt, just like Nicole said, Champs, thank you. You were the guys that prepared us, and all of your efforts, taking notes from you, doing the workshops, calling in each month, that's what had us, kept us working and had us prepared. So I definitely recommend the RAI workshop that Champs does. The baby-friendly RAI was very helpful in preparing for the on-site assessment, and then Champs mock assessment and the feedback that you gave, you guys gave us, that was, wonderful information and really had us prepared. So that the day of our on-site, it was almost like a sweet relief. We were like, oh, we've got this. We're ready, and we were proud to share our story. Because you all had us so prepared. But, this is kind of our timeline, how things kind of rolled out for us. We had our Champs RAI workshop in September, and then we had our baby-friendly actual RAI in October. And then we did the Champs mock assessment the first week of November, and then our on-site assessment was in January. But honestly, we were prepared. We could have... we were ready for our on-site. We wanted it to be November or December, but because of the holidays, we had to wait for a date that they were available. And so we had our on-site the second week of January. And just like Nicole was saying, it can be overwhelming, especially, being new in my role. I was just like overwhelmed with so many task, and I had so many checklists. I had to make a checklist to check off my checklist. It was just like so many things were coming at you from so many different directions, and you had to start somewhere. And so I, too, started making binders from the direction of Champs, and these were my 6 main binders that we had for our on-site assessment. We had, I called it my primary binder. The main binder was my baby-friendly binder, and it was like a 4-inch binder, 3-ring binder, and I left this binder in the room with the assessors throughout the on-site assessment, and that was our main materials, and I'm going to go through what all was in there. And then I had a binder for myself. Just because I'm a hands-on person, I wanted to have anything that they could possibly ask for. I wanted a copy for myself, and just little details about our facility. So I'll kind of go through that binder as well. And then we, too, from the direction of Champs, had binders for our assessors, and I'll show you what we had in that. We also had staff training manuals, and this was more detailed information. This was a binder that our lactation consultants kept up with, and they had that with them so that if they were asked questions about any of their training that they had provided for staff, that they could answer those questions. I'll talk a little bit about that. And then patient education. This was a binder that our perinatal educator had. She's the one that teaches our prenatal classes and does our pre-admission classes and discharge classes. So this was her binder of like her objectives and her outlines. She kept that binder because I was going to let her kind of speak to those things. And then our purchasing agent has his stuff together. So overall, we had 6 main binders that we worked from on the day of our on-site assessment. So starting off, I thought we would go through our baby-friendly binder. And this I had 5 main sections in this binder, a section that had our policies, and then underneath that tab I had like a copy of our current policy, our old drafts and archived versions of the policy. We had a section in there where we showed proof of orientation to the policy. So we had a short statement about our process and how we were had currently oriented the current staff to the policy, and then going forward we had our process for how we would going forward orient new employees to the policy and to the policy change. So just a paragraph statement in our binder, and then behind that we had our attestation statements for our providers, so our physicians and our nursing staff, where they signed and documented that they had been oriented to the policy. And then the last section of that under policy was any related policies. We had a copy of those, a printed copy of our policies. Then for staff training in this big binder, I had the grid. So I think my next slide, yes, is kind of what we, this was the grid that I used with employee names, and then we had a changeover in systems during our journey. So one system we had certificates in a couple of different places. So I listed out name of employees and then the date of completion, and then what electronic system we could find those certificates in. We later thought we understood that we needed to have printed certificates for all of these things, and so our clinical educators spent many hours printing certificates for each of these courses, and they had those binders that they kept with them. But later we learned that we didn't need to provide proof with a certificate for all employees. We needed to be able to access them, and this was kind of what we were planning to do with this grid. But actually print out the certificate for those that are on staff the day of the on-site assessment, so that when they select who they're going to interview, that's the certificate that they want to view. And so we were easy. That's a little easier when you had to look through 20 certificates to find the one that they needed for the interviewee, as opposed to the 190 certificates for all of the employees. So this was my competency and staff training grid that I used. So in my binder under staff training, I had a copy of that grid, and then I had a copy of where we provided ancillary staff training. We had a roster, and it was divided by department. I had each ancillary department listed, and below that section I would list out the names of the employees and the date they completed their training. And the final section under staff training was our provider training. And with that, I just had a roster that had the name of the provider and the date they completed the training. And then behind that, I actually had the physical copies of all of the provider CME certificates. So with that, I did in this binder have all of the provider CME certificates. On the day of the on-site assessment, she asked me early that morning when we were going through the binder, she asked who would we be interviewing, and I gave her the name of the providers that were scheduled to be interviewed, and she went ahead, since we had time that morning, she went ahead and looked at their CME certificates, but I had them all there, but she only truly looked at the ones that we were going to interview during the on-site. Okay, the third section was my data collection and audit tools. I provided this information. I had an audit tool for December for all of the baby-friendly audits. So Audit Tool 2, Audit Tool 4 and 7, Audit Tool 6. I even provided the summary of our chart audits that we do for CHAMPS each month, and a copy of the latest quarterly report. To my knowledge, she never reviewed that with me. Like I said, this binder stayed in the room with them for the 2 days of the on-site assessment. And so the surveyors could have reviewed that information while I was not present, but to my knowledge, they never looked at that information. And then the fourth section in my binder was the poster information. I had a sample copy of the poster, so an 8.5 version, 8.5 by 11 version of the poster, and then a listing. So listed out all of the locations where we had our poster on display. And then the final section of this main binder was about our community involvement. So we had a paragraph description for each of our, like our follow-up clinic, our support group that we do, our annual baby fair that we do. So we kind of had just a 2-page that was paragraph style, just kind of listing out our community involvements and community collaborations. And then any flyers that we had, so I put in there the flyer that advertises our monthly breastfeeding support group. All right. Then, let's see. Moving on. This was my binder that I kept with me the whole time, and so I don't think you have to do this, but this was just something that made me feel better and less anxious the day of the on-site. And so I had a sample agenda for, kind of I printed that off of the Baby Friendly website and just what was the day was going to entail. And then just some basic information about our hospital. So I printed out our facility data sheet just so I would have that information and some of our historical metrics. So, the CHAMPS quarterly report and then also the Joint Commission exclusivity and initiation reports that our quality department reports out. Then I had a copy of the staff training grid. It was just an extra copy of that just to with my notes, if there was a new hire or when they had new employee orientation scheduled. So if there were any holes in that grid, I had the explanation for that in my on my copy. Then I had copies of the staff audit scorecard. So I had made scorecards each for staff audits and patient audit and chart audits, and a month-to-month review of that each on a scorecard. So I had that just so if there were ever any questions, I could say, here's where we started, and this is where we've come from. And then I had a copy of the policy, just the current copy, and then I asked our purchasing agent to provide me also a copy of the fair market pricing, the grid, and the compliance verification form. That was my binder. And then the binders that we gave each of the assessors. So we had 2 binders. They were identical, but we provided them these binders that had contact information. It had my name and contact information, and then the 2 escorts that were going to be with them. And we provided them with a cell phone number and an office number for them. But honestly, they didn't need that information because the assessors really never left their side unless, the escorts never left them, and when they would go to the classroom and ask to be alone, the escorts just kind of hung around in our little lobby area outside the classroom. I also included in there, and I think it's on the next slide, the expected attendees for, it kind of jumbled those up, but I listed out the expected attendees for the opening session so that they could know that. And I did see she didn't do it during the opening session, but later one of the surveyors kind of made notes on that page. So I think that was helpful, having the people that were present and then their title. They do pass around a sign-in sheet that morning to get the name and title of the attendees. But I think this was helpful for her to see the number of people that were expected to attend. Then we provided a staff roster, and I'm not sure you can tell it on my next slide. They kind of stacked up, but I had listed the staff members that would be present for day shift and night shift on labor and delivery and our mother-baby unit. And then for providers, I had a provider list, kind of like a schedule, and that listed their name, their specialty, and the time that they were available for interviews. And then patient rosters was provided in there, and then Tupelo area information, just like how Nicole did for Olive Branch. So honestly, they didn't use their binders a lot. They left them in the classroom. They tore out the section that had the patient rosters, and they removed the section that had the staff members' names. when they were selecting the staff members that they would interview. But after they selected those staff members, they handed that piece of paper back to the escort, and they never really picked up their binders again until just for they were in the room, so they could have used those while they were preparing their reports on the second day. These were my patient rosters. I'm not sure, but the NICU mom phone call roster, we had one for that. We had the actual inpatients, and I think it's important that on that day that you kind of star or make note of those that would be being discharged that day, because that was one of the things the surveyors asked us right after our opening session. They wanted to know, did we have patients that were going to be discharged that day that they could go ahead and start interviewing. So on your inpatient patient roster, kind of identify who might be going home early that morning. We also, on that patient roster, made note of who was a high-risk patient and was on magnesium and might not be a good fit for an interview. And then our legal department, this was just an extra side note, our legal department also asked for us to make notations on our rosters, who the surveyors actually spoke to, and any medical records that they access. So you could make those notes on your rosters as well. All right, moving on. So before we get into the week before, with the staff training manuals, these were the binders that the lactation consultants had, and in that they had a copy of their grid of who had completed training, and then for each course that they taught. So for the 15-hour, they had the CE application that detailed out their objectives, their PowerPoint slides, any handouts, and all their sign-in sheets. They had all of that for the 15-hour and the 5-hour training. And they had the same content for ancillary staff training, and then also for any annual review training that they had completed throughout the years. Like I said, the clinical educators had binders with all these massive numbers of certificates that I don't think is necessary. I think as long as you print out the certificates for the staff members that will be present in the facility on the day of the survey, I think you'll be fine, and then be able to access, know that you can get to printed certificates if they should ask for additional copies, but they really only wanted to see the ones that they interviewed on that day. And then for the patient education materials, that was my perinatal educator, and she had her binder that had the prenatal classes listed out individually, and she had the objectives and the handouts for each course that she teaches, even our pre-admission class, the postpartum discharge class, and even a description about hospital tours and where all they tour within our facility and what's discussed there. So the week before, I just kind of took time to go back and read through our RAI feedback letter, and I read through the guidelines and evaluation criteria one more time, and then the CHAMPS mock assessment feedback, just kind of reviewed over those things, making sure we hadn't missed anything, hadn't forgotten the recommendations that they had given us. So I just kind of read through that. Our task force, we had a little huddle. When we had our RAI, we kind of typed up the sample questions that CHAMPS had given us and had assigned those out. So we updated any of that information with our latest audit score results and kind of made sure everybody knew what they were to speak to. I met with the purchasing agent one day. I scheduled a meeting with him just the week before and made sure he had everything that he needed and see if I needed to help him with anything. And then I went through our training grid, and the night before our on-site assessment, we found a couple of holes. So I would say, keep it a constant eye on that staff training grid. We had a new hire that came through their 6-month window, and so just make sure you get all those things in order. I started making my patient roster, especially my phone call list, that week before, even though you can't really make the final preparations until just the day before and even the morning of the survey. And then our educators were busy reviewing charts, looking through charts, making sure we had everything documented, and reinforcing when they did find omissions in the charting, they would go back to staff members and say, hey, don't forget, these are the important things that we need to see in your documentation. And then we had last minute, just a quick little update with our senior leadership and gave them some talking points and reviewed some of the sample questions that they might encounter during the opening session. The day before, we just did a walk through our building, one last little huddle with our task force to make sure everybody was on board and knew kind of the agenda and the timeline for the day. We got all of our binders together. We put those on our little rolling cart. We pushed it into our classroom, set up the classroom, made sure we had our mannequins and breast models for our interviewing rooms with our staff. We finished up our patient rosters, but I can't say enough about CHAMPS preparing us. They had us ready, and honestly, the day of it was so relaxed. And the surveyors were very complimentary, but I have to say it was because CHAMPS had us well prepared. We did call our patients before, those that had been discharged, and make sure that we could call them for interviews. And we did talk to each of our inpatients and let them know that we had surveyors on site and they might visit them and ask them questions about their care here. Our next steps, we hope that we're celebrating designation soon. I would love for that to be this week. We're just waiting anxiously to hear. So we think our next step will be celebrating our designation. Would like to move to skin to skin in the operating room. We do our skin to skin for C-sections. We begin that in recovery. And we have some physicians and anesthesiologists that are excited. So that's on our agenda next. And then currently we recover our C-section patients in an open bay recovery room with our other GYN patients. And so our next steps is to move towards recovering those C-section patients in their private LDR room. So those with regional anesthesia, we'll take them back to their labor delivery room and recover them there so that their father of the baby can be present and not have to stop skin to skin or anything for anything unrelated like to their care. So in that open bay recovery room, sometimes we have to stop skin to skin if we have another GYN patient coming in that has maybe like a loss or something. So just some sensitive situations. So those are our next steps. I'm excited for everybody out there that it is very doable. It was overwhelming at first, but I think if you can be organized, you'll be very prepared, and CHAMPS does a great job getting you that prepared, and your on-site assessment will be a breeze. So thank you to everybody that helped us.
Thank you so much, both Jennifer and Nicole, for presenting. So we have one question that's been chatted in so far, and feel free to chat in more, or you can say them out loud after. So this is from Amanda Anderson. She asked, who is typically the escort? So would it be a staff nurse or a lactation nurse?
This is Jennifer from Tupelo. My escorts were the clinical educators so we have an educator that for mother-baby and an educator for labor and delivery. And they were the ones that were most versed with the computer and the medical records. So we kind of assigned those two to them to follow them around because we knew if they asked for proof of documentation in the record that they could easily find that. And so it worked out well for them to be their escorts.
So for us, this is Nicole at Olive Branch. For us, we had the task force members assigned varying roles, and we are a much smaller facility. And so our task force actually is composed mostly of labor and delivery and special care nursery nurses. And so they were actual nurses. They were very familiar with the charting. So if they had any questions or if they needed to verify any charting or documentation, they were able to guide them easily to that.
Thank you both. Does anyone else have any questions they'd like to ask? Well, this is Maytal. I'll ask one. I am curious how both of you really made sure that you had enough patients available to ensure that your assessors had an easy time getting all the interviews they needed. So taking into account different things, was it easy to call your patients? Was it difficult to get in touch with them?
So I'll step in and go first. So being a much smaller facility, this was quite a challenge for us on a few different with a few different circumstances. We did call, but I'll be honest with you, I had to take a leap of faith with. I was able to get in touch. It was me. I was calling people, and I was able to get in touch with our prenatal list, but our postpartum moms, we didn't have enough on the unit, and so they had to call several of them, but I was unable to call them beforehand. So there was a lot of prayer involved with hoping that they had everything that they needed. I was very, very committed and still am. I mean, every day as the lactation consultant here, I still round on every patient and provide formula education or breastfeeding education as well as assisting. But we were unable to call those, and I guess those moms were able to answer all the questions and do well with the calls from Baby Friendly, because they did have to call quite a few of them. We did not have enough postpartum moms here on the floor, so we had to have our phone number lists well prepared and ready. And having 2 affiliated prenatal clinics, we also had to have those moms ready as well.
So with us, it was a challenge for us, as many of you know, if you're labor and delivery nurses. It seems like you have a rush of deliveries right before the new year. Everybody wants to get that tax break, and so if they can find a reason for induction, it seems like they do. But we were slow the week of January the 8th, and but we had enough patients that they were able to get most of their interviews completed without making many phone calls. So we had enough patients on the unit, and then we have a newborn follow-up clinic here within our facility where all newborns come back, and so they interviewed a few moms in that clinic for our postpartum interviews. And then with our NICU, they were able to get 3 moms. We had 3 moms that were visiting during that time, and so they only had to call two moms. So really they made like 5 phone calls is all that they had to call. We had a long list of phone call options for them. I say long, I mean 10 or 12 names, but they really only had to call about 3.
Great, thank you both. Anyone else? I think we might have time for one more question here. All right. Well, thank you all so much for joining our webinar today, and thank you so much to Jennifer and Nicole for sharing their experiences and their tips. And congratulations to you both. And our next webinar will be on March 18th. It's called Experiences from the Other Side, Ongoing Improvement After Designation. So this is after you've organized all your binders, you've had your on-site, you're designated, now what? So this will be a panel of representatives from hospitals as well, and it will be moderated by Jennifer Ustianov, who's Campus Sustainability Director. And if you do think of any other questions, feel free to email us. And thank you so much for joining the call, and have a wonderful rest of your Wednesday.